Pelvic floor muscle training can be used to treat various conditions such as urinary incontinence, urinary urgency and frequency, retention, pelvic organ prolapse, and pelvic pain. In this video, you will learn pelvic floor muscle anatomy and physiology and the principle of pelvic floor muscle training.
You want to understand that the main role of the pelvic floor muscles are they're postural muscles, and they're there to support your pelvis area and the lower organs such as the bladder, the rectum, and in women the uterus, right? And postural muscles, they work independently. They feel how much activity is going on, and they will increase in activity to kind of support that area. So you really don't have to think too much about postural muscles unless there is a problem with it. Then you have to rehab the postural muscles so then the muscles can work for you, right? The other thing that it does, as you saw in the other picture, is actually supports the external sphincter of the urethra. And when there is increased abdominal pressure, it has a reflex reaction. It will squeeze to increase that tension and support that so then you don't leak, right? So those are the two things. So the important thing is making sure that those muscles are functional, so it's helping protect you, and that the timing is right so then you're not leaking with coughing, sneezing, activities like that. And that they are strong because they will have more bulk and they will support everything better. The thing when you have surgery and you remove an organ, you might have a drop of the bladder. So the bladder might be sitting low a little bit, and the anatomy and the physiology of the sphincter might not be as good as when the bladder was higher up. So the muscles having more bulk will actually suspend the bladder a little higher. So it actually does kind of a similar thing as the sling surgery. So when you talk about pelvic floor muscle training, you're talking about first, can I actually activate the right muscles? Because it's a tricky thing to do. They're internal, you don't really see anything, you don't feel anything usually because they're small muscles. So the first thing is actually, am I actually rehabbing the right muscles? So that's number one. Then if you're doing that, then you go to number two. How coordinated are they? Can I squeeze effectively, and can I relax effectively? Because if you can't relax effectively, you're not going to be able to squeeze effectively. The timing is going to be off. You might be developing other conditions such as urgency, pain, so you don't want that. And sometimes incontinence, because when the muscles work too much and too hard, there's a point in time when muscles will kind of decrease in tone really quickly, and you have a bit of incontinence then. And usually when you're leaking because of tone, it usually happens later in the day. Because in the beginning, you just woke up, your muscles are rested, and then it starts to work really hard, and then in the evening you feel like you're not controlling very well. Okay. Then if everything is well, then you can start strengthening, if that's what you need, because sometimes you don't need strengthening. Sometimes you're strong. What you need is really coordination. Okay? So if you need strengthening, we can start a strengthening program, getting the muscles to improve in strength, but always give that relaxation time, because the relaxation time will let the muscles recover, and then when you squeeze the muscles again, you will have good strength, right? And the end kind of goal is to increase that muscle bulk, to add that passive support, and changing the urethral angle a little bit. Okay, so then you make sure that whatever you have functioning for you, you use it, so then you have less leakage.